A client with a history of alcoholism is unable to recall the events of the past week, despite having receipts from multiple businesses. The inability of a client to recall past events is known as A. Alcoholic hallucinosis, B. A hangover, C. A blackout, D. Sunday morning paralysis. The correct answer is option C. After hospitalization for atrial fibrillation, a client is being on Coumadin. Which of the following foods would be restricted while the client is taking this medication, according to the nurse? A. Cabbage, B. Apples, C. Potatoes, D. Macaroni. The correct answer is option A. A neurological consultation has been ordered for a client suspected of having absence seizures. The client with absence seizures is likely to exhibit A. Short, abrupt muscle contraction, B. Quick, bilateral, severe jerking movements, C. Abrupt loss of muscle tone, D. A brief lapse in consciousness. The correct answer is option D. A client is evaluated at the clinic and diagnosed with conjunctivitis. What is the reason behind conjunctivitis? A. Fever, B. Melena, C. Bacterial infection, D. Excessive sodium in the body. The correct answer is option C. The nurse evaluates the results of a urinalysis performed on a dehydrated client. Which outcomes should the nurse anticipate? A. Increased WBC, B. Presence of protein, C. Presence of ketones, D. Increased specific gravity. The correct answer is option D. On cardiac tissue, a medication may have inotropic, chronotropic, or dromotropic effects. The nurse is aware that medications with a chronotropic effect can result in A. A change in heat rate, B. A change in force of cardiac contraction, C. A change in conduction of cardiac impulses, D. A change in valvular strength. The correct answer is option A. Which blood dyscrasia should be mentioned in the instructions for a patient with systemic lupus erythematosus? A. Dressler syndrome, B. Polycythemia, C. Essential thrombocytopenia, D. Von Willebrand's disease. The correct answer is option C. Anxiety induces alterations in the neurohumoral release patterns of neurotransmitters such as A. Acetylcholine, B. Epinephrine, C. Insulin, D. Sodium. The correct answer is option A. An infection of the urinary tract is a potential complication of which of the following body systems? A. Respiratory, B. Cardiovascular, C. Gastrointestinal, D. Genitourinary. The correct answer is option D.